This is Zederic Chavez. At 5 years old, he looks like any other 5-year-old. He loves sports. He can run, walk, and, oh, by the way, did I mention he loves sports? He's made remarkable progress for a boy who was born at 28 weeks and was diagnosed with cerebral palsy dystonia and was told his future was bleak.
I was scared. Didn't know what to think because they told me he had 50% chance of living or dying. They didn't know if he was going to make it. And if he did, that he was going to be in a wheelchair bound and not be able to walk, crawl, run, talk. So it was scary. I didn't know how to take it.
Zederic is Erica's firstborn child and had family support from her mother and dad. Still, that worried her parents, a single mom with a child needing lots of help.
We didn't know if we could handle that. And then he was born, so he had a lot of problems. And it's just kind of scary trying to raise a child like that. When we took him home, it was like, do we need any monitors? Do we need this? Do we need that? Because we were scared to take him home. We were afraid something would happen to him. But so far, he's done really well.
The road to his success, though, wasn't without a lot of hard work. The therapist at the Permian Basin Rehab Center began working to strengthen his body to give him a chance to be normal. His companion through it all, Pat Fierro with the Permian Basin Rehab Center.
You know, Zederic is actually one of those special cases. You know, he's a miracle baby, and so he's been through a lot. The family have gone through a lot also, and so I've made relationships with the family themselves too. You know, as much as we see the patients here, and so some of the things that they have gone through, and some of the things that we've seen. You know, that kind of makes it more personal.
Major improvements in the use of his right arm, his ability to weight bear through that right arm during various activities. So you see the progression in his strength over the past 2 years, and his ability to try harder and use his right hand in everything.
As he began to make progress, there was also work getting him to use his right arm and hand. He also needed work on something you and I take for granted, eating.
At the time that he first came, he wasn't able to chew. He was kind of transitioning to table foods, and so adult foods that we eat all the time. He would chew on the meat, chew it, but he would never initiate a swallow, which seems, so easy to do. But for him, he's always had, with his weakness on his right side, there's always been weakness all over his mouth, especially in his cheeks and with his tongue. And we all, without even thinking, we use our tongue to clean out our mouths to finish swallowing, and he just wasn't able to do that. But now he's able to actually get the food out of his cheeks with his tongue.
To see him progress as he has, it's wonderful. It's just, he's doing things that I thought he was never going to do because the doctors told you he wasn't going to do it.
Therapists also recommended Botox injections to help with dragging of his foot and the use of his right arm. He gets these every 3 months, and it works. In fact, his mom notices it makes him more normal.
It's who I look up to because he's gone through so much and pulled through. And
does that make it that much more special for you?
Yes.
Sure.
Not knowing what was going to happen to him, not even knowing if he was going to make it out of the hospital, but we did a lot of praying, and God got us here, and we're here.
I'm gonna make